CarePlus provides full non-medical caregiving services to Southern California.
Compassion and excellence in home care service makes CarePlus the best choice.
The CarePlus team of specialists provides assistance with daily living needs.
At CarePlus, we put our hearts and minds together to match the best caregiver with you and your loved one.
Being able to sleep and knowing my mother's safe and being properly taken care of, it's given me peace of mind.
At CarePlus Home Care, we recognize the value of every person.
And welcome back. Well, we have Roland on today from CarePlus Nursing Services. Nice to see you.
Hey, hi there, Ken.
We were just talking about turkey right before you came on, and the merits of different ways of if you want to deep fry turkey or not. You were telling me when you lived in Georgia there was a lot of fires.
Exactly, very common thing.
Yeah, don't want to recommend that. But I do want to recommend CarePlus Nursing Services, and you have a lot of different things that you folks offer, don't you? I mean, it's really quite a bit, from occupational therapy to physical therapy, even speech therapy.
Correct, yes. The holistic approach for people that are needing any kind of assistance at home is something that pretty much all home health agencies that are large enough to offer these different services strive to do.
Mm-hmm.
Physical therapy, for instance, a lot of people get confused between, and it's hard to differentiate between an OT or occupational therapist or a PT or physical therapist. But a lot of the work they do is actually, they overlap to some degree.
Mm-hmm.
I guess the best way I like to describe it is the physical therapist works on the person to try to get them up from the bed, take them to the bathroom, or maybe into the kitchen. Basically moving from point A to point B. Anything that happens within that time frame is usually the physical therapist.
Okay.
And then you get into the occupational therapy part, which talks about more of the fine motor activities, such as zipping up your jacket, or even buttoning your shirt, cutting with a knife, or using a utensil for eating. A lot of the fine motor stuff, or the things you would do once you get to point B, like if you get into the bathroom, brushing your teeth, combing your hair, getting to the kitchen, preparing a meal. That would be an occupational therapist's job.
So between the two of those, would an occupational therapist have additional training over a physical therapist? Is it more of a specialized thing, or?
Okay, no, that's a very interesting question. Actually, I was just kind of looking at I was just looking at a website a couple of days ago because somebody was asking me about with the impending changes with some of the healthcare coverage and the medical field and how it's going to be delivered. A lot of the goals for, let's say, the physical therapy side, the American Association of Physical Therapists is actually, they're trying to move for legislation to allow direct access by 2020. What I mean by that is that they're moving a lot of the training to become doctors in physical therapy, just instead of just being straight out physical therapists, because of the changes in the best practice guidelines and the evidence that we have in providing the care. Both disciplines actually have been moving towards that angle. So they equally, right now, I know the physical therapy training maybe is about a year longer right now, but a lot of the occupational therapy schools have also started to move towards a doctorate level of education as well.
Okay, so maybe in 2020 or whatever year this comes along, you will see the doctor in front of their name, and then after their name, a PT or
correct
something like that.
That's right. Yep.
Okay.
And the same thing with the OTs as well. They'll the initials they will be having is the OTD, or occupational therapist doctorate.
Yeah.
Yep. Yep.
Okay.
So.
And speech therapy is quite important. There are people who might have had a stroke,
correct,
or from something else, where their speech is they're learning to talk again.
Correct. It's one of those speech therapy is one of those misnomers. They actually are really what they're called are speech and language pathologists. Is actually what they want to be called, and I think by profession that's what they're listed as. I think the healthcare field as a whole kind of term them as the speech therapist to kind of combine them with the therapy department as well. They don't really just rely on they just providing treatment for learning how to speak again. They do have a lot of tools and practices that can help people learn how to talk and verbalize words and talk with clarity. But aside from that, they also work with people with swallowing issues. And which is a very big part, especially if you have a stroke, like you had mentioned. A lot of people do end up aspirating, which is bringing any kind of fluid or food particles into the lungs because you're not swallowing the items appropriately, or you're eating the wrong diet. Because there's different kinds of levels of diet, from mechanical soft to the regular diet. And in these situations, a speech therapist is very a huge part in maintaining and ensuring that we can prevent that kind of occurrence from happening, which prevents hospitalization.
Okay. So it's a lot more involved than just, I mean, years ago, speech therapy was somebody you thought about, you had the speech person that was in a school somewhere, and maybe kids that had trouble speaking or had a speech impediment. That's what you thought of.
Correct.
Back then.
Yeah, they've really kind of managed to allow themselves to diversify their services as well. And it's interesting with the three, just almost like recapping the three. You know, the physical therapy has an overlap with occupational therapy because they do certain things that are very similar. I know OTs like to work with the upper extremities, PTs like to work with the lower extremities, the legs and versus the arms. But then you go into this OT, the occupational therapist and the speech therapist, they also have a little bit of an overlap. The OT, like I mentioned, likes to work on fine motor, so they teach people how to write. The speech therapist kind of tries to work with people to try to recognize numbers, letters all over again if people forget how to do that, as well as they work with memory tools so that they can, like when people tend to be forgetful, they can write it on a calendar so they can refer back to it and be reminded by themselves without any kind of assistance.
Interesting. And of course, as the name implies, skilled nursing you provide and skilled caregiver assistance.
Correct. With the nursing, I think to be honest with you, it's the base membrane of what we do. The nurses tend to act as case managers for most of our care. They look at the patients a little bit more holistically because they look at the patient in the physical aspect, the psychological aspect, and then the medical aspect. So they really try to cover a lot of the requirements for the individual person that's at home. They go in there, they check on the medication, they make sure that the right medication is being taken. They assist the individual in planning or preparing the medication on a daily basis, so they take the right amount of medication and the right medication as well. If the person has any wounds to speak of, they can assist in getting the wounds dressed appropriately. And I mean, they're also there to just make sure that if they can call the other disciplines in as needed. And of course, with the help of the caregivers, we can really get people back home and they can kind of settle in and recuperate well with the assistance of a skilled caregiver.
Right. And finally, social worker, which is very, very important. And it's just that aspect of people are, you know, if they had a stroke or an accident or whatever, it's just their emotional well-being is maybe not there, and this is something a social worker can help with.
Correct. I mean, when you look at the act of aging, sometimes leaves a lot of people by themselves.
Right.
It's just an act of nature sometimes, and the evolution of how things happen. When people don't have any support, like a spouse or family or friends that are nearby, a social worker can be there to kind of assist in getting them hooked up with the right agencies so they can get the right amount of care that they need. And even with those people with families, that social work can help the families and the individuals cope with the changes in their life because of the illness.
Right.
So,
yeah, they kind of act as whether it's kind of like the glue in a way, because as you said, it's just sometimes an act of aging, but sometimes the social worker will lend a hand between the parties within the family.
correct.
And how to deal with the person that is maybe going through something or even reconnect with everyone. So
That's right,
they're
yeah.
quite important. Roland, thank you very much.
Great,
A lot of
yeah,
good
thank you,
information.
yeah.
We appreciate it. And if you want more information, you can go to careplusnursing.com. And there's the number on the screen, 716-2273. And we appreciate it. Thanks for coming on, and
Okay,
have a
thank
good
you.
Thanksgiving, all right?
Thank you. Happy Thanksgiving to you too, Ken.
All right, take care.
Thank you.
We'll be back in just a moment.
CarePlus Home Health is dedicated to providing personalized and compassionate care in the patient's home setting.
Whether you need the skilled care of a nurse following a hospital stay or just a little work with a therapist, CarePlus Home Health is there to assist.
We have a variety of specialty programs, including palliative care.
CarePlus Home Health, delivering professional care with a personal touch. Call us today